Welcome to DME Basics. In this course, you'll learn about durable medical equipment and reimbursement so that you can better understand the industry and how to become a valuable resource to your customers. This course will cover what durable medical equipment is and what it isn't, and how durable medical equipment is reimbursed. Durable medical equipment, or DME, is a term used to describe medical equipment used in the home to help people achieve a better quality of living. Durable medical equipment consists of items which are primarily used for a medical purpose and are not useful in the absence of illness or injury. DME items are ordered or prescribed by a physician and are reusable and can stand repeated use. They must be appropriate for use in the home. Some examples of DME items are wheelchairs, hospital beds, canes, crutches, walkers, rollators, oxygen, pressure mattresses, and lifts. Durable medical equipment does not include consumable medical supplies, or items which are non-durable or disposable in nature. Items which cannot stand repeated use, even by more than one individual, are not considered durable medical equipment, nor are items which are not useful to a person without an illness or injury. Some examples of disposable medical supplies which are not considered DME are bandages, rubber gloves, and syringes. Some products which are not considered DME may be used in conjunction with DME products. For example, our suction machine is considered DME, however, it must be used in conjunction with a catheter that must be purchased elsewhere. Durable medical equipment may be paid for by private insurers, Medicare, which is a national program, or Medicaid, which is a state-run program. Reimbursements vary across both. Equipment may be furnished on a rental basis, or it may be purchased. DME providers must supply medical documentation for any type of insurance in order to be reimbursed. It's the provider's responsibility to gather the necessary documentation and qualify the patient. Medical documentation may include a letter of medical necessity. For a service to be considered medically necessary, it must be reasonable and necessary to diagnose or treat a patient's medical condition. Medical documentation may also include the history and physical exam, or H&P, which is the starting point of the patient's story as to why they sought or are now receiving medical attention. The history portion contains the chronology of what is wrong with the patient, or the chief complaint, or CC, and the results of a physical exam. Progress notes are part of a medical record where healthcare professionals record details to document a patient's clinical status or achievements during the course of hospitalization or outpatient care. Some DME equipment requires a face-to-face, which may be conducted by the physician, physician's assistant, nurse practitioner, or clinical nurse specialist, who must document that the individual was evaluated and or treated for a condition that supports the items of DME ordered. A face sheet is a document that gives a patient's medical information at a glance. Face sheets can include contact details, a brief medical history, and the patient's level of functioning. HCPC codes are used for billing Medicare and Medicaid patients. HCPC stands for the Healthcare Common Procedure Coding System and is a collection of codes that represents procedures, supplies, products, and services which may be provided to Medicare beneficiaries and to individuals enrolled in private health insurance programs. In order to be reimbursed, certain HCPC codes require a valid, detailed written order prior to delivery. The written order for the DME must include, at a minimum, the beneficiary's name, the item of DME ordered, the prescribing practitioner's National Provider Identifier, or NPI, the signature of the ordering practitioner, and the date of the order. Failure to meet any of the above requirements will result in denial of the claim. If a hospital or nursing home is providing Medicare-covered care, these facilities don't qualify as your home. A long-term care facility does qualify as your home. If you're staying in a skilled nursing home facility and the facility provides you with durable medical equipment, the nursing facility is responsible for billing the durable medical equipment. In this course, you learned what durable medical equipment is and what it isn't, and how DME equipment is reimbursed. This knowledge will help you become a valued resource to your customers. Please answer the following questions to check your knowledge of DME basics. Note that there is no audio for the quiz.